Good afternoon, everybody. We're going to go ahead and get started. Want to say first, thank you so much for signing in for the webinar today on your Justice and Mental Health Collaboration Program grant for Category 1 grantees, reducing the number of people with mental illnesses in jails. Again, thanks for joining us today and congratulations on your grant. We are thrilled to be working with all of you. My name is Katie Habert, and I'm a Deputy Program Director here at the Justice Center, and I'll be kicking us off today. Next slide, please. So you all join a great grant track, I have to say, that is small but very mighty with a lot of exciting work happening. And what we'd like to accomplish on today's webinar is to really talk about this grant track a little bit more in depth. I know that we've had orientation calls with most folks. Want to dig in a little bit more into what the grant program is like, specifically for this track, what we have planned ahead and what our work is going to look like together, what it's like to have been a grantee. We have a person on the phone today who I'll introduce in just a moment who can share some of her experiences with you all and really start to connect with one another. This is the beginning of what we hope is a lot of coordination and collaboration amongst you all here and really creating a community to learn from one another as we go along. So we'll be doing some introductions, an overview of the grant program, and then some information on the grant requirements and how we can help, and then turn it over for a discussion amongst all of us on the phone today. Next slide, please. So you have a lot of folks on the call today that you'll hear from, a really great group. We have Maria Fryer, who's the Justice System and Corrections Policy Advisor for Substance Use and Mental Health at the Bureau of Justice Assistance, U.S. Department of Justice. Myself, who I've already introduced. You also have Risa Hanneberg, who's the Deputy Division Director for the Council of State Governments Justice Center. Marilyn Leak, a Policy Analyst for CSG Justice Center. Roseanne McPhail, who's the Human Services Program Specialist for Pacific County, Washington, and Sheila Tillman, who's a Senior Policy Analyst at the CSG Justice Center. So a lot of folks on the team today. You'll be hearing from each of us. Want to give you a little bit of a flavor of the team that we have working behind the scenes and with you all directly at the Justice Center and beyond. So Maria, I'll go ahead and turn it over to you for comment.
Great. Thank you, Katie. Hello, everybody, and welcome. My name is Maria Fryer, and I'm a policy advisor for the Justice and Mental Health Collaboration Grant Program here at BJA. It's commonly known as the JMHCP program, and the Bureau of Justice Assistance is often called BJA, and that's how we sort of refer to the organization throughout. I'm so excited to be here with everyone today, and I feel so honored to oversee this program. We accomplished so much, as Katie said, and we're just going to grow forward together in this JMHCP endeavor, and it's very exciting. I've been in the criminal justice field for some time as a professional. Had the opportunity to do many things. I got my beginnings in law enforcement and spent a lot of time in community corrections as well, and finding alternatives to incarceration for adults. And that was a really great experience. And I look forward to working with you to make your JMHCP grants a success. As I mentioned, I work in the policy office as a policy advisor, and I oversee substance abuse and the mental health portfolio, it's really large. We have a lot of things going on, a lot of programs, a lot of initiatives. You heard Stepping Up. Stepping Up is one of the initiatives that's within my portfolio that I oversee, along with a lot of other great policy work. There's a large body of work in the early identification of people with mental illness and connections to treatment. And so I'm really proud of that work, and now you're all part of that. So it's wonderful to be here with you today. So with that, we're going to open this orientation by recognizing and acknowledging your accomplishment. You have succeeded in securing grant funding in an incredibly competitive year, and congratulations on your award. Slide. The Justice and Mental Health Collaboration Program supports innovative cross-system collaboration for individuals with mental illness or co-occurring mental health and substance abuse disorders who come in contact with the justice system. A major goal of JMHCP is to facilitate collaboration among the criminal justice, mental health, and substance abuse treatment systems, and to develop and implement collectively designed justice and mental health strategies. I know you all heard from us about the JMHCP grant program in the past and in previous webinars, so now I'd like to focus on your individual cohort, the Category 1 grant program. And as you may know, JMHCP falls into 3 categories, each with specific goals and criteria. Next slide. The Category 1 grant program is the smallest of the 3. And since its creation in FY15, there have been 18 total JMHCP Category 1 grants. There were 5 in FY15, 6 in FY16, and 7 in FY17. And now, with FY18, you are one of 11 grantees. So we're growing. The Category 1 grant program aims to help counties decrease the prevalence of individuals with mental illnesses in jails and takes a collaborative system-level approach to intervention. We know this may seem like a daunting task, and so as part of the grant, you'll be working with one of our partners at the Council of State Governments Justice Center for technical assistance throughout the process. I'll turn it over to the Category 1 JMHCP Technical Assistance Team to help explain exactly what that means. I'm giving it back to you, Katie.
Thank you so much, Maria. So, as folks may be familiar with, as we have been introducing ourselves in orientation calls in January, as well as potentially through other work, as Maria mentioned, the Council of State Governments Justice Center is funded by the Bureau of Justice Assistance to provide technical assistance on behalf of the Justice and Mental Health Collaboration Program. So the CSG Justice Center, for folks who are less familiar, we're a national nonprofit, nonpartisan membership association of state government officials representing all 3 branches of government, and we really focus on providing practical advice informed by the best available evidence. And so we have been the grantee providers for this particular grant program since its inception in 2006, and have just been very lucky to have worked with grantees in the past and you all here today. The Justice Center, as has been mentioned previously, you may have heard of work that we've done at the local level through the grantee work, through JMHCP. We are also technical assistance provider for the Second Chance Act program through the Bureau of Justice Assistance. We've worked on Stepping Up, a national, a national initiative to reduce the number of people with mental illnesses in jails, as well as justice reinvestment at the state level. I mention these things because we have clearly we have a bunch of folks on the call here today as your team. We have a lot of resources internally as well as externally in terms of partners we can connect you with, et cetera. So as we're talking today and thinking through and getting started with all of the technical assistance, we're really able to help offer you direct connections not only to other counties, but to other experts within our organization and outside of our organization. So we look forward to working with each and every one of you to really tailor what that looks like. To get into a little bit more detail about the technical assistance and sort of the basis of that, I'll go ahead and turn it over to Risa Hannenberg, who is an advisor for this grant program as well, and has a ton of local experience and has worked with the grantee track since the beginning. So I think you'll all find her to be a great resource as well. So Risa?
Okay. Well, good afternoon and probably good morning to a few of you. My name is Risa Hanneberg. I serve as the Deputy Division Director with our Behavioral Health Division at the Justice Center. And I, too, want to congratulate you. I have been on your side of the table and been a grantee, and I just know, what a huge accomplishment it is to, first of all, get that notice that you received your grant, and now, to really power up and be ready, to do this work moving forward. I want to just make sure and kind of spend just a few minutes talking about the Stepping Up initiative, primarily because in this particular grant track, category number 1, you will see that this work totally aligns with the Stepping Up initiative and not by accident. And so we, really greatly appreciate BJA creating this a grant track so that as we work across the country with, I just looked a little bit ago, we have 467 jurisdictions that have passed resolutions to join the Stepping Up initiative. So the effort to reduce the number of people with serious mental illness in our jails across the country. You are actually going to be the boots on the ground. As Maria already shared with you, this is a grant track now that's really young, and just a few years under our belts in terms of pushing forward this work, working directly at the county level, and working with you as you move through your P&I guides and start to really roll up your sleeves and come after all of your work a plan to push forward your efforts and what fits your needs and what would best be your response to addressing this issue. So it is, as I said, by design. It's no accident, and you will see that P&I guide and all of our TA calls and many, many times that we are working with you on your TA calls and in webinars and so forth, that it is aligning with Stepping Up and the framework that's presented through the 6 questions document and following the 4 key measures. And those of you, as I read your narratives, I know that this is not new language for you because you have already chosen to be a part of this work, and we thank you for that. Next slide. And this just illustrates, again, on the map, the different dots across the country. Again, we're up to 467 sites today, so we're excited about that. And, it really encompasses, if you not just look at the geography, but you look at the population centers, a huge amount of the population across the country are involved in the Stepping Up initiative. Next slide. And so just so you all can see where you land on the Category 1 work, again, congratulations. The previous sites have the smaller yellow stars, and you guys are the bigger, more golden orange stars. So we are, getting a little more widespread across the country, and I can certainly promise you, as we work with you, we'll be very often referencing some of the work that's been done in your companion sites and connecting you and really pulling together to build an entire, resource, if you will, as far as laying down the groundwork and also being an example for those other counties across the country that are not receiving this level of technical assistance. So I think I'm turning it back. I think I'm turning it to Sheila.
Yes, thank you, Risa. So as mentioned before, my name is Sheila Tillman, and I'm a Senior Policy Analyst at the Justice Center. Although I have been providing technical assistance to JMHCP grantees for over 4 years, this is my first opportunity to be able to provide technical assistance to Category 1 grantees. So very much looking forward to working with you all on this grant. So just to talk a little bit about the grantee orientation process. So we held the general JMHCP orientation webinar last month. And if you were not able to attend, or if you would like access to the recording and PowerPoint slides, those all are posted on our website. Also last month, many, if not all of you, connected with your TA provider and have had your initial orientation call. The Category 1 specific webinars, the webinar you are all attending today, right now, and like the general orientation webinar, the recording for this webinar will be available on our website. A couple things to keep in mind for next steps. Make sure you complete the grants financial management training within 120 days of awards acceptance. The completion of this training is required for programmatic and financial POCs for the grant. Additionally, begin reviewing the P&I guide. The guide will be sent to you by your TA provider or can also be found on our website, and I'll talk a little bit more about the P&I guide in a bit. So to move into a little bit of the grant expectations for the Category 1 grantees. So grantees will engage in a collaborative planning process with county leadership toward the goal of reducing the numbers of individuals with mental disorders and co-occurring substance use disorders in jails who can safely be supervised and or treated in the community. These grants support a targeted analysis of the prevalence of people with mental disorders in the jail, a review of existing community resources, and identification and initial implementation of policy and practice changes to minimize contact or deeper involvement of individuals with mental disorders and co-occurring substance use disorders in the criminal justice system. Additionally, Category 1 grantees will demonstrate a commitment to system-level reduction in the prevalence of mental illnesses in jails. Beyond intercept-specific programs, counties will work toward a coordinated response to maximize diversion for individuals with mental disorders. That includes a county system analysis to identify strategies to reduce the prevalence of individuals with mental disorders in local jails, screening and assessing all people with potential mental disorders booked into the jail for criminogenic risk and needs, recording this information in an electronic record, ensuring this information is shared appropriately to inform pretrial decision-making, and defining mental health needs in terms that align with state definitions that pertain to eligibility for publicly funded mental health services. A key component, as well as a grant requirement to making changes to processes or operations within a system, is the establishment of a planning team, which includes representatives of county leadership, stakeholders, and decision makers from multiple agencies, including criminal justice, behavioral health, and community providers. An additional requirement of the grant is to work with us as your technical assistance provider. We will provide support, guidance, and advice while you work through your grant objectives and requirements, including activities such as the completion of the P&I guide, identifying measures and strategies to track progress, and sharing successes with stakeholders, the field, and press. The technical assistance we provide includes a variety of formats, such as monthly technical assistance calls, P&I guide support, provision of helpful resources, national meetings when applicable, and the opportunity to meet and speak with you in person during site visits. To hear more about what technical assistance looks like for grantees, I'd like to invite Roseanne McPhail from Pacific County, Washington, a fiscal year 15 Category 1 grantee, to speak for a couple of minutes about her experience with technical assistance. Roseanne?
Thank you very much. I too would like to just echo congratulations to all of you. This is really exciting that you received this grant, and it's a great opportunity and a great way to sort of really get your work supported and continue moving forward with it. It sounds like a lot of you have already taken the Stepping Up initiative, and so that's exciting as well. My name is Roseanne, as Sheila said, and I work in Pacific County as the Stepping Up Initiative Coordinator, and I do the oversight for the JMHCP grant. We started out in 2015 as a Category 1 grantee, and then we're currently a Category 3 grantee. So I just want to say first, sort of overall around the technical assistance is this is really, really an awesome resource. And your TA provider or providers will be your cheerleaders and also sometimes your lifeline. They really are your connection to resources, and the people that I personally, and I know from our county, have found that they are the individuals who help you really see your successes and your progress when sometimes you may not be able to see it when you're in the middle of just doing your work. So just kind of starting with the top of it, I want to say looking at monthly phone calls. Coordination, if some of you are doing just the coordination piece for this grant, it can sometimes seem isolating, and maybe that's because it may be your primary job, and a lot of the partners that you'll be working with, it may not be their primary job. So as you're trying to move this forward, you're also doing a fine dance with other individuals around how much information and how much time of theirs that you can have. So it's a really important way to stay connected with other people doing the work and letting them know what you're doing and getting that feedback. It is that opportunity to see your progress when, as I said, sometimes you are in the thick of it and it may not feel like you're moving forward when actually you are. Phone calls also a great opportunity to get feedback on those hurdles that you might be going through, or as I like to call them, those speed bumps. It's that ability to connect you with others as you're talking to your TA provider, and you may be just kind of giving a report about what's going on or what issues you're having. They can really connect you to others who've done this work, who maybe have already gone through something similar and might be able to provide you with help. Also resources. So I would say share any and everything that you have going on with them, because they really have a lot of other relationships and information at hand, and they have been great on those phone calls, being able to get information to me and connect me to other people who can help me with what I'm going through. Let's see, moving down, resources again. I'm guessing most of you are familiar with the Stepping Up website and the Stepping Up Toolkit. I can't say enough about that. The self-assessment tool, the website, archived webinars, all the other resources that are available. Try to familiarize yourself with that, and then also go back to it, because sometimes at the beginning of this work or this grant, things may not make sense, but a little later down the road, they may. Meetings, national meetings, regional meetings, if you have the opportunity, networking with others who are doing the work is also really invaluable. And then I want to say quickly about site visits. They're awesome. So if you have an opportunity for site visits, it's really a great thing. It gives you the chance to bring partners together during the time that you have CSG people coming to do site visits, and it adds sort of that greater connection to the work that you're doing. Again, I will say sometimes, depending on where you're located and how many maybe neighboring counties that you might have to work with, this work can seem like you're just working in a bubble. And that connection to the greater good and the work that's going on nationwide, I will say, is invigorating and inspiring. It also gives you an opportunity to showcase your community. It gives you an opportunity to let people know what's going on. And it really helps, I think, with future calls when you're talking about things that are going on in your area. If someone has had a site visit and they have met people or seen the area and know what you're talking about, it can be really helpful. And I think we'll talk more about the P&I guide at a later slide. So back to you.
Fantastic. Thank you so much, Roseanne. A couple more items to note about the grant. So Category 1 grantees will initially have access to up to $100,000 of the total grant award. And to access the remaining grant funds, a determined portion of the P&I guide, about the halfway point, will need to be completed, submitted, and approved by BJA. The remaining sections of the guide will then need to be completed by the end of the grant to close out your grant award. So your TA provider will be sending you a suggested timeline for completion of the P&I guide that reflects these benchmarks. And certainly if you have any additional questions about this, please feel free to ask later today or ask your TA provider on your next technical assistance call. The last thing that I want to note in terms of requirements for the grant is performance measurement tool reporting, or PMT reporting. PMT reports are required to be submitted quarterly. And if you have additional questions about PMT or the PMT reporting process, please reach out to your BJA advisor or the PMT helpline. and we can certainly send that information on to all of you if you need it. The P&I guide. So as previously mentioned, the completion and submission of this guide is a grant requirement, and to receive more than the initial $100,000 of the grant award, this guide does need to be completed, submitted, and approved by BJA. That being said, this guide was designed to be a tool used for planning purposes, and hopefully you all will find it useful. The guide provides exercises to help you move through planning steps, such as identifying people with mental illness in the criminal justice system, identifying appropriate services, identifying connections for folks to those services, and ensuring that the right folks are receiving the right level of treatment. In addition to assisting grantees through different process elements through the use of exercises in the guide, grantee responses will also help us to identify what grantees are doing well in their system or challenges the grantees may face, which helps us to ultimately create opportunities for peer-to-peer learning and provide targeted technical assistance. Roseanne, I was wondering if you could speak a little bit about your process working through the P&I guide.
Sure. Excuse me. So first of all, I want to say that initially getting the grant and then looking at the P&I guide seemed to me a little bit overwhelming. So I just want to say, may not be that way for others, but it did feel that way initially. And so once I kind of got over that and really familiarized myself with the document, which is what I would say I would encourage you to do, is kind of familiarize yourself with the document. And once I could see it as sort of a living document to really get down the information that we were already doing and really look at it in the way of what are our strengths and what do we already have in place and what are those things that we really want to work on, and it helped us to prioritize. Then I found it a little bit friendlier of a tool. So I will say that at first I probably didn't utilize it in the best way possible. So I would encourage you to familiarize yourself. Don't put it off. Kind of go through it, look through it. If there are things that you can fill out ahead of time, now with your first look, please go ahead and do that, because I think that helps make it seem a little bit less daunting. So as I say, once my TA providers were very patient because I think that I had a resistance to it, but once I could see that it was an organic process and that it was nonlinear, and I could go through and really look at that and go, here we have this, what do we have, and use my TA providers as support for that. It was really helpful. Another thing that helped me to remember was kind of going through and looking at things and realizing that it was okay to answer no, and that just because this guide was here, we really weren't expected to have everything put in place as we went through it. So just kind of going back to the fact that it's a living document, how it looks for you right now today, I'm sure there are things that, that could be filled in, and that at a later date, as you continue to move through this work during your grant, there will be things that you can fill in continually. So as a coordinator, I was able to use this tool to help set meeting agendas. So when I had meetings scheduled to bring our task force together, I could look at the different sections and where we were and what the priority was, and use that to kind of guide the meeting, the specific meeting for that. So that was really helpful. There were some things that, as a coordinator, it was easy for me to fill out because I knew the information, so I didn't necessarily need to pull the team together for some of that stuff, but I could take the completed sections to the team, get feedback on that, and get their input. And the other thing I would say is, especially when you get looking at some of the early parts of the P&I guide, I had to be okay with disagreement and especially when we were looking at shared definitions, and really let the team work together to come up with shared definitions that we could really base all of the work that we were doing with. So it was really important for us to go through that process as a team to make sure that we got to a point where we could have a common agenda, and we could really look at shared measurements and what were those things that we were going to continue throughout this work. So that was something that was really helpful. Let's see, using your TA providers. I kind of wrote some notes to make sure I didn't forget things. Using your TA providers for support when you're going through this process was very important for me. And also, again, adapting the P&I guide for what will work in your county. So are there sections of that P&I guide that may be easier for you to do small work group sessions with? Are there sections of that P&I guide that are important to pull the larger group together? So again, for me, kind of going through it, instead of looking at it as just there's one way to do it, kind of taking that document and getting to know it and letting it guide me, and then being willing to be flexible and adaptable with how I got the information to plug into there. The other piece that it did help me do was, as a team, as a sort of that coordination and leader, is to bring those successes back and celebrate those. And again, I just want to reiterate, sort of, it helped us to utilize the strengths of the different partners, and use that document to kind of look at people's expertise, whatever the partner was, whether it was our behavioral health agencies or criminal justice, utilize each person or partner agency's strengths to help get us through those sections of the P&I guide. So it really is a valuable tool, and again, a living document. So that is a little bit about what worked for me. And in summary, I just want to say, like, to be sure and reach out if there are things around policies. Reach out to your TA providers, because you don't need to reinvent the wheel if you don't have to. So as you go through the guide, there may be things that will really help you to be able to fill information in. So be sure and reach out to those resources. That's it.
Fantastic. Thank you so much, Roseanne. You hit on a lot of great points, and I very much appreciate you sharing your experience with us and with the new cohort of grantees. Thank you. I am now going to turn it over to my colleague, Marilyn Leak. Marilyn?
Thanks, Sheila, and thanks so much, Roseanne. That was super helpful. So like I mentioned, my name is Marilyn Leak. I am a policy analyst here at the Justice Center, and I have been working with the Category 1 grantees for the last year and a half or so. So I've already had the pleasure of having phone calls with a few folks on the line, and really looking forward to getting into everything moving forward. So in this next section, I'd like to touch a little bit on the document that you'll be hearing a lot about in the coming months. It's called Reducing the Number of People with Mental Illness in Jails, 6 Questions County Leaders Need to Ask. This document we call the Stepping Up Framework document. As you heard at the beginning of the presentation, the Category 1 grant program is really laid out very much within the Stepping Up framework, so we wanted to touch on the basic principles here. In the interest of time, I'm going to kind of fly through this, but rest assured we will be spending lots of time on your monthly TA calls and through the P&I guide, going into a lot more detail on these things. So for the first question, is your leadership committed? One way to do this is to pass a Stepping Up resolution, which I imagine a lot of you are familiar with, at least at this point. But if anyone is not, it is a signed commitment from your county leaders to reduce the number of people with mental illnesses in your local jail. Counties can also engage leaders in a number of other ways, through presentations to leadership committees or working with local champions for your effort. The second question is, do we conduct timely screening and assessment? Many of you included goals around this in your grant application. Basically, in order to address the problem, counties need to be able to quantify the need to understand exactly what the problem is. So using a validated mental health screening tool and follow-up clinical assessment for everyone booked into the jail will allow counties to know exactly how many folks with SMI are in the jail and be able to really plan on how to address that. Number 3, do we have baseline data? So you'll be hearing a lot about the 4 key measures. I'm going to jump ahead just so we can see the slide. Basically, these are 4 primary data points that we've identified to help you plan through this process. Question 3 relates to establishing baseline data within these 4 key measures. So you'll want to know, number 1, how many people with SMI are booked into your jail. Number 2, how long are those people staying in jail when compared with the general population? Number 3, are those people being connected to treatment services in the community and when they're released from jail? And number 4, how often are those people coming back to jail when compared with the general population? And once you have that baseline data, then you can use the data to really guide your planning process. Question number 4, have we conducted comprehensive process analysis and service inventory? Many of you may be familiar with the sequential intercept model. This is one model of system mapping that people use for this. There are a number of other ways to do it, but basically we hope to help you look at how your system as a whole and examine exactly what your local assets and services are, as well as your gaps and needs. Question 5, have we prioritized policy, practice, and funding improvements? This question hopes to use both the baseline data and the process analysis from questions 3 and 4 to really come up with a data-driven priorities and funding plan. And then question 6, do we track progress? Once you start implementing changes, you want to be sure you continue to review the data to understand what impact you're having and adjust as needed. So I know that was a really quick rundown with a lot of information. I do want to note that the P&I guide is specifically laid out within this framework, and the exercises are designed to help guide you through this planning process. So now I'm going to throw it over to Risa Hanneberg, and she's going to talk a little bit about some of these tools that we've been touching on through the Stepping Up initiative. So Risa?
Yes, okay, so again, I just want to emphasize how much your grant track aligns with Stepping Up. And so for those of you who have already passed resolutions and you've probably already visited the Stepping Up website, and even if you haven't, I hope you have taken the time to go to just Google Stepping Up, and it will pop right up for you, Stepping Up Together. And so some other resources that you can also use in conjunction with your grant work, and the first one you see there is the Project Coordinator's Handbook. And particularly for those of you who are on the call that are the project coordinator, or you have responsibility for facilitating this project, the handbook, I would really strongly suggest that you also possibly download, at least look at it online and see how much it can be a resource to you as you kind of do that behind the scenes planning of the work and what the meetings are going to look like and what you hope to accomplish. You will see that the exercises that we've included in here are going to be the same that are in your P&I guide. So again, it's very much a companion tool for you. Also, one of the things we're going to be encouraging you to do, if you haven't already, is to complete the online county self-assessment. Again, it's there at the stepuptogether.org website, and this literally takes you from step 1 all the way through the final steps of tracking progress and so forth, and asking you every question along the way as to whether or not you have implemented or partially implemented or not at all implemented the particular step. This will give you a great baseline as to where you are in the Stepping Up process and also, again, with your grant work. So we will be encouraging you to complete that assessment tool. And then you'll see as you move around the website, we have, first of all, we have just released a second brief. So there's now 2 briefs out there that are, again, complementary to the 6 questions framework. And the first one goes into way more into depth on screening and assessment, and we just released one on establishing baseline data. Next slide. And then just again, to just give you a quick look, this isn't everything that's on the website, but there is, if you click on the resources toolkit, you'll see a lot of different options there, particularly on that first chart that you see. As you click on each of those questions, it will take you directly to the various webinars and materials that relate to each of the 6 questions, and so you can go and retrieve those if you want to listen in more detail. And then we have case studies and other kinds of documents that have been released in relation to the Stepping Up process. And finally, if you are stepping up site, you are invited to participate in quarterly network calls. These are divided up, again, more by your geographic size and where you're at. So there's rural, urban, and mid-size different choices for you to become a part of a cohort and be able to call in on a quarterly basis. And it's basically just a facilitated discussion, and we normally have a topic, but it's also a time to just ask any questions or kind of, get direction if you're having some sort of policy question or process question. I think that's it for the tools.
Thanks, Riza. Okay, so for this next section, this is actually the part I was looking most forward to. We want to hear from you guys. So, like we've mentioned multiple times throughout this webinar, a big part of the technical assistance is connecting the grantees for peer learning opportunities, and especially with the Category 1 group, because the grant goals are so in line with each other, we have found that these peer learning opportunities and being able to connect the grantees is really beneficial. So for this next section, we were hoping to hear from you. So just a quick bit of housekeeping before we do this. We are going to open up the lines to everybody. So if you could just please be sure that your phone is on mute. And then, so if everyone's muting when you're not talking, then it shouldn't be too much background noise. And then also, just in the interest of time, we're going to ask that just one person from each county, if they can give a little background, what jurisdiction you're calling from, who is here from your jurisdiction, so team members who are on the call, and then if there's one goal that you're particularly excited about working toward in the JMHCP grant program. So, Bo, if you could go ahead and open up the lines. And then I also want to say we've had a couple of questions come in. We're not ignoring you. We'll have some time for Q&A at the end, and we'll address anything that was written at the end. All right. So I'm just going to go down the list. Just so we have about 3 minutes per grantee. So really just a quick overview, if you can, would be great. Let's start with Bernalillo County. Bernalillo, are you out there?
Hi, everybody. This is Sam Howarth with Bernalillo County. Margarita Chavez is with me, too. And I know Judy from Project Echo's on the phone, and I'm not sure who else from the county. But I'll provide a real brief update, and others can chime in if there's additional information. So we've been meeting, and we have developed what we are calling like the core planning group, which is representation from the county, representation from Project Echo, and representation from the Institute for Social Research at the University of New Mexico. And our first brainstorming efforts have been around a couple of things. Who else would we invite to join us and guide this project? And we're in the process, we've generated a list of types of individuals, and now we're in the process of putting together some, for lack of a better word, marketing materials to talk about the initiative, both with the press and with individuals that we're going to solicit to be a part of the process. We realized that we sort of needed more than a piece of paper that said, yo, we'd like to invite you to be a part of this enterprise, but that we should be able to describe it cleanly. And so that's one front we're working on. The other thing that we've done is we've divvied up, I'm blanking on the name of it, with the various sections.
Planning guide.
The planning guide. So different people are taking the initial lead on completing the planning guide. There will clearly be holes, and then those initial sections, once complete, will be shared around the group to see what information we have and what information we need to actually go and try to chase. What else am I missing?
Just the project itself.
Well, the project itself is being driven by the planning guide currently. So we're looking at what data what data we do have and what data we don't have currently.
Great.
Hi there, this is Margarita.
Yeah,
I know that Pam Acosta is also on the line with us from Bernalillo County. She's our Inmate Benefits and Social Service Program Manager down at our Metropolitan Detention Center. So Pam is providing a wealth of knowledge from within the jail, and so I think that will really be instrumental in implementing this program.
And Gabe Mims also with the county as part of our team, as is Pam. And he does adult detention reform out of the Office of General Counsel with the county.
Wonderful. It's great to hear such a, oh, go ahead.
The other, just in terms of roles and what people bring to the table, perspectives, I guess, Margarita is the Deputy Director here at our Division of Behavioral Health Services, and she's also overseeing our Regional Resource Reentry Center. So we've got representation from the jail, from detention reform, from our Regional Resource Reentry Center, myself, which is more about data quality assurance, quality improvement, Dr. Paul Guerin at ISR, who is their director and is much about, has a long history of analyzing MDC jail data, transition data, et cetera. And between the BHI, Behavioral Health Initiative folks, me and Margarita, we're and including Pam at the jail, we're all very aware of what transition planning and discharge planning efforts are already in place and how this will buttress those efforts. Oh, and Judy's with Project ECHO and is providing really a strong facilitative role in convening us, keeping us on track, supporting our efforts in those and other ways.
Great. Well, it really is great to hear such a diverse group of stakeholders already coming together. I mean, this really is intended to be a collaborative process, and it sounds like you guys have really laid the groundwork for that, and especially for a diverse planning team and for a structure in place to help work through this stuff. So great to hear from you. How about Boulder County?
Yeah, hi. This is Marco Prospero. I'm here with Christopher Hines with Boulder County, and it sounds really good to hear that we're kind of in line with where our peers are, at least hearing from the first county there. We too have convened a stakeholder group, and we're starting to work through the plan. We have a couple things where it looks like some of our practices, such as implementing a screen that we started piloting here at the jail not too long ago. The brief jail mental health screen is going to be something we might be able to continue to implement. And we're just, getting started, getting everything going. We're going to hire one staff member that's going to work as a coordinator half-time on this grant, as well as the rest of us, offering our in-kind hours. So we're just real excited. This is an initiative that we definitely have been interested in doing, and we're pairing it with another BJA grant that's focused on folks that are struggling with opiate use disorder. And so we're hoping to join those two initiatives together.
Wow, that's great. Yeah, I mean, as we mentioned before, the screening and assessment is a huge piece of this, and it's great to hear that you're already piloting the brief jail mental health screen. And definitely, it's always really exciting to hear folks that are collaborating with other efforts. We love to hear that, so that's really great. Thanks, Boulder County. How about DuPage County, Illinois?
Hi there, this is Scott Kaufman. I'm here in DuPage at the DuPage County Health Department. I'm working as the project coordinator for our team, and I'm working very closely with our project director, Mila Segalis. She's serves in that role on a few different grants here at the health department, as well as our behavioral health assistant director, our director of behavioral health, Lori Carnahan. And then we also have some partners from our county jail and sheriff's office. So we're really, really jazzed about this this grant because it's going to allow us to go a little bit deeper than we've got a lot of cool, interesting ideas that we were excited to get going, but with this funding, we're able to actually start them. Among those are some expansion of screening and referral that's going on in our jail. We hired about a year ago a reentry specialist. She does unbelievable work, and we want to be able to give her a little bit more specific guidance and assistance about what we're trying to accomplish in the jail in terms of reducing recidivism for people with mental health issues. And we also have an exciting mobile response pilot. So instead of a central receiving center, which we've seen a lot of great examples of those, we're trying to get a pilot where we have clinicians come out and visit the person in crisis rather than having the officer bring them to us. So we're excited to see how that pilot works out, but a lot of exciting stuff going on. And in terms of what we're most excited about, beyond those two things, I think just giving our behavioral health collaborative more solid structure and sustainable direction. Really excited to get going and keep hearing more from everybody that's also been awarded this wonderful grant.
Great, thanks so much. Just thinking about that mobile response pilot, I mean, we've had a few, not just Category 1 grantees, but a few stepping up counties who have had a lot of success with those mobile response and co-responder programs. So as you get a little more into it and kind of figure out where you want to go with it, we can definitely hook you up with some peer connections to learn and hear what other folks are doing around the country. How about Jackson, I'm sorry, I skipped El Dorado County, California?
Hi, this is Gary Romanko. I'm the Deputy Chief of our probation department here, and I will be the project coordinator for this grant. We are typically, probation department anyway, is typically the tip of the spear when it comes to cutting edge initiatives, new grants, those types of things. And we often have issue with collaboration in our county among our stakeholders. And one of the things that we're really excited about is we hope that this will be a catalyst in bringing together a lot of those stakeholders, because this initiative is really has a lot of common goals among all of our stakeholders, and we're really excited that this will be something that can bring us all together and address a lot of the issues that this brings forth. So that's us.
Cool, great to hear. Yeah, I mean, I don't know if you guys have looked in the P&I guide yet, but that whole first section is all about outreach to stakeholders and different things. And there's also in the Project Coordinator's Handbook a number of facilitation tips that we hope will be helpful as you guys try to do that. So that sounds great.
Thank you.
Sure. How about Jackson County, North Carolina?
Hey, this is Shannon Queen from Jackson County Sheriff's Office in North Carolina. And you've probably got, I don't know, unless somebody else speaks up after me, maybe the cop of the group who is far outgunned by what we're talking about so far. And with that said, is my collaborative partners for this project weren't able to join us today on the phone call, but the basic project that we're doing here is the initial assessment of inmates as they're entered into the jail or booked into the jail. And we're doing a collaborative project with our contracted medical provider that we have for our jail staff, as well as a mental health provider in the community that's already working within our jails and working with some doctors and research team that Western Carolina University has to offer. And that group has a lot of great ideas. I am basically just the project director with the keys to the facility to allow the research teams and the mental health professionals to come into the detention center and allow this to take place with our inmates. We're not only doing it with our Sheriff's Office, but there is another Sheriff's Office that we are joined with that has the same project. The project is just run through our Sheriff's Office, and we will help the grant process along. But so it's actually 2 different jails in 2 different counties that this project will be serving.
Great, thank you. That's actually, we have a couple of folks from our fiscal year 17 cohort that also were in a similar boat, either having a couple of different jurisdictions or, across counties or across jails. So hopefully as you get a little more into it, we'll be able to make those connections, and you guys can hear a little about how they were able to focus on that.
Thank you.
So thank you. Yeah, no problem. How about La Fourche? I hope that I'm saying this right. La Fourche Parish, Louisiana?
It's La Fourche.
La Fourche, okay. Sorry about that. I thought I might butcher it.
That's okay. It's okay. My name is Lieutenant Tara Sutton. I'm the Assistant Warden and Reentry Director for our correctional complex in La Fourche Parish. We have a brand new complex. We've actually been in occupation now for about 2 weeks. And our entire complex is built on a foundation of innovation and comprehensive rehabilitation services. Mental health services have been identified as a gap and barrier facing our citizens that fall into our judicial processes. This grant is going to play a key and vital role in our diversion efforts. We put together a solid platform, an initiative and narrative with the blending of crisis intervention training and the Stepping Up platform that will drive a really core collaboration effort between patrol, correction, our whole entire correctional facility, and our community stakeholders to better serve those with mental health needs in our community.
Great, wonderful to hear. How about Nevada County, California?
Hi, this is Andrea Sexton. I'm from Nevada County, California. I'm with the Health and Human Services Agency, and Phoebe Bell, our Director of Behavioral Health, is also on the line. And Nevada County joined the Stepping Up initiative in 2016 and has had an existing group kind of working on some of those processes. And when we received this grant, we kind of pivoted that group to start focusing on kind of the issues of gathering data. We were finding that we had a dearth of data about the prevalence of mental illness in the jail. So we're looking forward to using some of the processes in iGuide and other things to get that data. Our grant plan also adds a therapist position to the jail, which we hope will be coordinated with our jail medical provider, which is contracted, and also to maybe help connect folks who are leaving the jail who still need services, better connect them with services outside the jail. So that's our plan going forward right now. We just started doing the P&I guide, and we decided on the brief jail mental health screen to kind of help to implement that on booking to help guide further assessments.
Great. Yeah, that's great. I mean, especially as you get into the second half of the P&I guide, there's a lot of data-focused exercises, and we'll spend a lot of time talking about that stuff. So it's great to hear that you guys are already prioritizing that. How about Lucas County, Ohio?
Hi, my name is Lindsay Below, and I am the Behavioral Health Criminal Justice Coordinator. So my position was created to really look at the intersection of behavioral health and criminal justice systems in Lucas County and to improve those outcomes for constituents who find themselves at one of those intercepts in the system. So I'm going to act as the lead on this specific grant. And through my position, we also created the Behavioral Health Criminal Justice Committee, which is a committee of stakeholders from judges, prosecutors, the county commissioners, the sheriff's office, our top 5 behavioral health agencies, our correctional treatment facility, the police department, the VA. So we really have all of the stakeholders at the table committed to meaningful cross-system collaboration in order to effectively service people who find themselves in the criminal justice system with behavioral health needs. And that group is going to be charged with going through the P&I guide for this grant application. And we have begun that process and have started with a smaller working group comprised of individuals from that larger group, and bringing people into that smaller working group on an as-needs basis, depending on exactly what stage of the guide that we're going through, just to keep the numbers smaller. It's a little easier to work with, 5 to 7 people versus 25. And then we have our smaller working group reporting out directly to that larger committee. And we are also a MacArthur Safety and Justice Challenge site, and signed on to the Stepping Up initiative in 2015, and also completed our second SIM report. We had a workshop to do that mapping in May of 2018. So this really just aligns with all of the work that we've had going on the last couple of years, and we're very excited. This grant will provide us an opportunity to implement a jail screener. We're looking at the brief mental health screen as well, and then a linkage process to connect individuals to community resources that we have upon their release.
Great. Thank you so much. Yeah, it's great to hear. I think you're not alone in that you're participating in multiple projects, so the Safety and Justice Challenge, the sequential intercept mapping. That's something that we see in a lot of our Category 1 sites, that they're doing these things in conjunction with the JMHCP Category 1 grants, and so there are lots of ways that these projects run in parallel, and it's always really exciting to kind of collaborate and see how we can get them to work together, so that's great to hear. How about San Luis County, California? Okay, so maybe we'll come back to San Luis. How about Screven County, Georgia? Anyone from Screven County?
Yes, hello, can you hear me?
Okay, how about, yes, hi.
Hello, this is Dr. Mitch Miller. I'm on the Screven County team. I can't tell if I'm coming through or not.
We hear you.
Thank you. Okay, well, I'm a professor at the University of North Florida in criminal justice and a scientific consultant on the project. 2 other research team partners are on as well today, Dr. Brian Miller from Clemson University and Dr. Holly Miller, also at the University of North Florida, as well as our practitioner partners, Chief Deputy at Screven County, Brett Dickerson, as well as our mental health partner from Behavioral Health, which is a local mental health services provider for a 3-county region in southern Georgia. Well, we have just completed the phase 2, or the planning stage of the grant, wherein we were able to align formal agreements between all of the major law enforcement and mental health and research partner stakeholders to move forward. We were able to select and shape for hopefully implementation that will be allowed through this second phase, a justice mental health intervention, which will be a case management intervention approach. So we've also were able to develop a formal justice mental health policy for the county moving forward, primarily with the team, but also informed by a larger community group of stakeholders on a broader planning team, they were called. So we're optimistic about moving forward to this phase and implementation, wherein we look to first hire a case manager, continue to strengthen the mental health training of the law enforcement officers in Screven County, as well as give a strong evidence-based orientation to the project overall with an ongoing data collection system so we can track key indicators of interaction with mental health offenders and responses to such.
Great, thank you. How about Seneca County, Ohio? Anyone from Seneca County? Okay, and then one last check.
Hold on. This is Dr. Michelle Pena from Seneca County. Sorry about that. I thought I had some other team members on there, so. So we're at the point where we're waiting for our budget to be approved, but we're all ready to go with proceeding with hiring a case manager to be employed in the jail so that they can do screenings at bookings to see if there's behavioral health needs. And if so, then we are also going to have a 20-hour-a-week mental health therapist, substance abuse therapist in the jail providing services. And then in addition to that, we will also be doing some training of law enforcement officers on CIT training, mental health first aid training, burnout training, and that kind of thing. So we're just waiting for the green light to go once the budget's approved, and then we'll get that going along with the data collection.
Great, good to hear.
Thank you.
Okay, so last call for San Luis Obispo.
Hi, this is Ryan with San Luis Obispo IT. I'm the project manager for the Stepping Up project right now. Brief history, our Board of Supervisors signed a resolution in October of 2017 to commit to the Stepping Up initiative. Since January of 2018, we have been tracking we created the brief jail mental health screen. We've been tracking that with jail bookings, tracking jail length of stay, and then we've been working on measures to reduce recidivism. Right now we are doing 8 measures, and the goal is to have them fully automated. We have a structure, an architecture that uses information from our probation system, jail system, sheriff, and behavioral health information systems. And essentially we kept moving forward with that. We had up to 27 measures, but we're going to use this grant to kind of pare that back and take the best practices from this organization that can help us really improve upon that. So we want to bring it back down and use the resources from the grant. Thank you.
Great. So that was everybody from your cohort, and as you can hear, I mean, I definitely found there were a lot of themes. As you can hear, a lot of people are working on the same types of projects, things from screening and assessment in the jail, setting up a planning team and outreach to stakeholders, data collection and analysis, things like that. So there definitely seems to be a lot of themes and a lot of potential for peer learning opportunity connections. So we have just about 7 minutes left, so I want to make sure we answer any questions that you have. So we've had a couple that have come in through the WebEx. So the first one was a question about, do the county self-assessment and the P&I guide overlap? So I don't know, Risa, do you want to take that one?
Yes, I'll take that one. And also, I know there was another one just about how there was like a sequencing or how to use the tools that are in the toolkit for Stepping Up versus the P&I guide. So let me just kind of try to walk you through all of these. We really designed these tools to be not mutually exclusive, but very much complementary. So, but you guys are all in a different stage and situation given you're a grantee and you have the P&I guide to fill out. So, my advice, and, I've spent a lot of time in working in developing these tools and thinking about how I would use them if I was the project coordinator. So many of you have identified yourself as that, and you really are, in my opinion, a key person as far as organizing the work, pushing the work forward, and, leveraging all these resources. So the P&I guide is absolutely, a requirement as a grantee. But if I was a project coordinator, I would also be leveraging that handbook just because there's a facilitator tips in there and just other kinds of information that is probably most, if not only, helpful to the coordinator. we want you to complete the self-assessment tool just as a first step. It will give you and us a great idea as your baseline as to where you're starting from, what will already start to formulate as next steps for you as you start thinking about, where you're at, where you're heading, and eventually some prioritization work. And then the other tools, foundational document on the 6 questions, I would make sure everybody on my planning team has access to that. That's just the basics, 1, 2, 3 of what this work is about. Other things that are in the toolkit are access to the webinars. So, for example, if you're struggling with screening and assessment and implementing that, there is a webinar out there that walks you through that you could easily download and listen to. Not that we're not here to help you and guide you and also connect you to other sites, but it might just be helpful to leverage those webinars. And then likewise, there's a lot of supplemental documents where we just felt it was good to hear, from example counties, those case studies, and then just, diving deeper into things like what are the necessary data points in helping you work with tracking the 4 key measures. So I'm hoping that answers a couple of the questions we've seen come through.
Thanks, Risa. Excuse me. So we've got a couple of minutes left. I wanted to throw it out to the group to see if there are any outstanding questions or comments about things that we've covered today or the general grant cycle. Okay, well, hearing none, I just want to say thank you so much to everybody for joining today. If you do have any questions or anything comes up, feel free to reach out to your technical assistance provider or to anybody here on the line. And we will look forward to talking to you on the next TA phone call in February. Thanks, everybody.
Thanks.